Hi, Bruno Jr. here. Our podcast, Busting Addiction and Smiths, is sponsored by SafeHouseRehab.com. SafeHouse believes that traditional treatments fall short of the needs of clients who face the modern problems of addiction. Modern problems need modern solutions. Multiple addictions, multiple relapses, multiple triggers, and cheaper and more powerful street drugs set up unprecedented challenges facing treatment centers. What is needed is a more sophisticated approach, a better way forward. There are 3 reasons to choose our progressive modern treatment program. 1, a more sophisticated intake process. 2, technology proven to enhance recovery. And 3, the most robust aftercare program in our sector. To learn more, visit us at safehouserehab.com.
How bad is it really? The addiction crisis is deadlier than ever before, which means that your son or daughter or anyone you love now has a greater chance than ever of succumbing to the deadly disease of alcohol or drug addiction. Why do I bring this up? It seems that unless we point out how bad it is out there, people revert to the "it can't happen to me" or "to my Johnny." By it, I mean death by overdose. If you don't abuse drugs, you won't die of an overdose. If you or a loved one does, I present you with some truly scary facts. I'm thinking that if I scare some people, some of them might go online and ask for help from AA.org or Al-Anon.org. The latter is for families and friends of addicts or alcoholics who want to learn how to recover from what is essentially a family disease. Or you might want to get in touch with a trained addictions counselor. Make sure that the counselor or psychiatrist is trained in AODA, alcohol or drug addiction, or you could easily be led astray with conventional but misguided theory and treatment. According to the CDC and other private researchers, this is what's happening in the U.S. today. Overdoses lead the way. Today, overdoses kill more of us than breast cancer, guns, and car accidents combined. Overdoses are the #1 cause of accidental death in the U.S. More recently, more than 100,000 fatal overdoses were reported to have occurred in the United States in the last 12 months as of late 2021. And much of that is attributable to cheap, easily available fentanyl. That is by far the highest number of overdose deaths ever recorded in a single year, and finally it has become a major topic of conversation in the media. Synthetic opioids like fentanyl account for more than half of overdose deaths. Fentanyl is the new heroin. It's cheaper, more than 100 times as powerful, and exponentially more lethal. There was also a 46% increase in overdose deaths from other stimulants like methamphetamines and a 38% increase in deaths from cocaine overdoses. This is an uphill battle. Only 1 in 10 who need addiction treatment ever receive it. Addiction still has a huge stigma. Over 80% of us do not want a friend, colleague, or neighbor with addiction. The addiction crisis is deadlier than ever before. During the COVID-19 pandemic, this tragedy has gotten worse. In some communities, overdose-related emergency calls are up as much as 40%, and 42 states of the 50 reported increases in overdose deaths during the pandemic. It's not just overdoses taking lives. In 2020, more than 175,000 deaths in the U.S. were related to alcohol and other drugs. That makes substance abuse the 3rd largest cause of death in the nation. Alcohol-related accidents are a difficult metric to fully understand. There are those impaired drivers who die in the accident and kill and injure others. And there are those impaired drivers who survive with or without injury, but surely cause needless suffering or even death of innocent people. Multiply that 175,000 by at least 3 to get a better sense of the true human cost. True effective addiction treatment is hard to access in the U.S. Only 1 in 10 people who need treatment ever receive it, and even fewer receive high-quality care that's rooted in scientific evidence. Medications are one of the most effective treatments we have for substance use disorder, but many cannot get them. 60% of residential treatment facilities don't offer addiction medication like methadone, Librium, or buprenorphine. Even though addiction is seen by most as an illness, treatment has long existed outside of mainstream medicine. In a survey of physicians and nurse practitioners, only 1 in 4 said they'd received addiction training during medical education, which means that 3/4 of the time addiction will not be recognized or treated. The patient leaves the office with a prescription for depression, which may be just to alleviate his feelings of sadness, but do nothing at all for his fentanyl addiction. Treatment for addiction isn't one size fits all either, but health insurance coverage often limits patients' options. In many states, Medicaid does not cover residential treatment, and only 60% of employer-sponsored health plans cover addiction medications. And extra hoop jumping like prior authorization requirements delay and limit access to life-saving care. That said, there are several high-end, well-known alcohol and drug rehab centers that cost anywhere from $25,000 to $50,000 a month, while equivalent professional treatment overseas in countries like Thailand cost a fraction of that amount. Unequal opportunity. Overdoses are rising more quickly among communities of color. The annual growth rate of overdoses from 2018 to 2020 for Black individuals, 16.1%, and Latino individuals, 12.6%, well surpassed the rate of white individuals during the same period of 3.8%. What's more, overdoses among Native Americans are above the national average, and the rate continues to grow. Stigma makes it more difficult to receive compassionate, high-quality, evidence-based care, and racism makes this work worse for Black individuals. Access to treatment dramatically favors white individuals, who are 35 times more likely to receive a prescription for buprenorphine, a medication for addiction treatment shown to increase the odds of successful long-term recovery. Black people are more likely to experience negative legal outcomes for drug offenses. Approximately 14% of the U.S. population is Black, and they use substances at similar rates as other populations, but they represent 29% of arrests for drug offenses and 33% of people incarcerated for drug offenses. That's about double the rate of the white population. Still a sad reality. People suffering from addiction receive punishment more often than treatment. Addiction is the only medical illness that's criminalized, but punishment does not reduce drug use or overdoses. 137,000 people in the U.S. are in jail for drug possession. Approximately 137,000 people are in state prisons or jails in the United States on any given day for drug possession, often for possessing small amounts of illegal drugs. And penalties are doled out inequitably. Racial and ethnic minorities, especially Black and Latino Americans, are significantly more likely to be arrested and receive stronger sentences for drug-related offenses. More than half of those in state prisons and 2/3 of people awaiting sentencing in jail exhibit problematic substance use or meet the criteria for addiction. What's more, while people with substance use disorders serve jail time, they have incredibly limited access to evidence-based treatments. It doesn't have to be this way. Addiction costs our country more than $740 billion each year, and the costs keep rising. We're hemorrhaging money on this crisis, and all that spending is not doing much to protect our loved ones. With the science we have today, we could save countless lives and spend a fraction of that amount by increasing access to addiction treatment with an approach that's compassionate, evidence-based, and rooted in public health. So while you struggle with understanding addiction and/or alcoholism, know that you can make a difference for the world around you, even if your own world is feeling hopeless right now. We should all be committed to ending the devastation caused by the disease of addiction. Addiction is highly treatable, but that treatment must be rooted in evidence and scientific best practices. For more ways to get connected to the cause, go to aa.org or na.org or ca.org or alanon.org. In this essay, we learned some sobering truths. We learned that 1. Overdoses are the leading cause of accidental deaths in the USA. Most people have no idea. 2. The easy availability and low cost of fentanyl plays an outsized role in overdoses. It's the new heroin. 3. Only 1/4 of medical professionals have any training in addiction, which means we must choose very carefully and make sure that they are 100% qualified to treat addiction. 4. We must speak up to our local leaders to make treatment more available, to make it known as a disease, and to make quality treatment available to all citizens regardless of race or belief.
Our podcast is sponsored by safehouserehab.com, a modern approach to recovery. To learn more, visit us at safehouserehab.com.